Perhaps you remember the names that changed the way we view the heart forever. Cardiologist Dr. Jeremy Swan and Dr. William Ganz saw a great need and solved it with a great invention with the Swan-Ganz catheter. Now Dr. Ganz' son, Dr. Peter Ganz, also a renowned cardiologist, has done it again. This time, a revolutionary product that promises the world apart to forever change invasive heart procedures. Welcome to SeeMedX.
Well, I'd like to introduce myself, Dr. Peter Ganz. I'm a professor of medicine and cardiology at University of California, San Francisco, and I'm a member of the advisory board of SeeMedX. I was actually born in Europe. I was born in what used to be Czechoslovakia, came to this country when I was in my late teenage years. I was fortunate to go to Harvard Medical School where I got my education. I did my residency at Mass General Hospital, cardiology training at Brigham and Women's, and I was in the faculty of Brigham and Women's Hospital for 25 years. And then I came to San Francisco to be the chief of cardiology at one of the hospitals here that's affiliated with the university. And I'm no longer the chief. I stepped down about 3 years ago to focus on research. And research is what I like to do in addition to education and taking care of patients. The reason I joined the board of advisors to SeeMedX is that I like the problem that they are trying to solve, the problem they are focused on. So we talked a little bit about the Swan-Ganz catheter, but the broader area that we should think about is something called heart failure. Heart failure is a condition where patients often suffer from breathlessness and fatigue. Breathlessness because their lungs fill up with fluid, fatigue because their pumping function of the heart is diminished. And these patients often require hospitalizations, and for breathlessness typically, and in many instances also their lifespan is shortened. They have high mortality. There are several issues where I thought SeeMedX could actually help in the management of heart failure patients. One is what we know is that when we have a heart failure patient who's been admitted for heart failure and is discharged, that many of these patients have to be readmitted again with another episode of heart failure. Specifically, if you look at the Medicare data, about 25% of heart failure admissions are readmitted within 30 days, and 50% of the patients are readmitted within 6 months. So the question is, how can we keep these patients out of the hospital? So, one option is some invasive device, implantable device. And these are actually very useful as a proof of concept for sure. There's more than one. The one that I would say is best known is called CardioMEMS. So they've shown that monitoring of pressures in the heart can not just prevent hospitalization, but in the most recent studies, it's been shown to reduce mortality. I would say the potential weakness of CardioMEMS, but it could be improved on, is one, it is an invasive device. It's implantable. And two, it's pretty complex to actually analyze the data. So you almost need a dedicated team, even in a tertiary hospital, that monitors a group of patients with these CardioMEMS devices. So it can be done. It's labor intensive, expertise intensive, and somewhat invasive. But the question is, could this be done less invasively? And so, the SeeMedX technology uses something called bioimpedance, a big word, bioimpedance. And what that is it actually measures the resistance, or also known as impedance, to electrical current that is actually very low level of current is actually introduced through your chest. And it turns out that if there is a lot of fluid in your lungs, the current actually encounters little resistance because fluid is a very good conductor. On the other hand, if there is no fluid in your lungs, so the current has to travel through bones and lung tissue where the resistance is much higher. So being able to measure impedance, which is really resistance to current as part of the testing, tells you about the amount of fluid in your lungs, non-invasively. There is a fair amount of data already available in publications that these measurements of bioimpedance with these SeeMedX technology correlate well with the more invasive measurements, so there's correlation. But the next question is, well, what are the potential clinical applications? So I would say maybe 3 of them in the order of importance. If this could be used as a home device in patients who are at high risk of having to be hospitalized for heart failure, maybe at high risk because they've been hospitalized previously, you might have that window of days to 2 or 3 weeks where the patient and the provider could be alerted that patient is having a buildup of fluid in their lungs, even though they may be unaware of it. And if that could be detected, you could actually potentially prevent hospitalizations. So in my mind, if this can be accomplished, it would be a huge benefit to patients. It also would be a huge benefit to the country, financially, potentially even. At this point, there are about 6 million patients in the US with heart failure, and about 500,000 hospitalizations each year for heart failure in the US. So if even a fraction of these heart failure hospitalizations could be prevented, this potentially could be of great benefit to patients and maybe also economically. So this is my favorite application of this device potentially. I would say my second one would be in hospital. So the first one would be at home. The second one would be in hospital. And when we admit patients with heart failure because they have too much fluid on board, we get rid of the fluid. In medicine, we call it diuresis. We diurese the patient. And when we discharge them, we hope to discharge them with all the extra fluid removed. But it's not easy to prove that we've removed all the extra fluid. We have some ways of telling, but I would say we need better ways of telling. So if the SeeMedX device could be actually used in the hospital prior to discharge, just to prove that all the extra fluid has been removed, I would view that, again, as a benefit to the patients because it might reduce the risk of the patient having to come back. If you haven't removed all the fluid, then the risk of the patient coming back is higher. That's known. And I would say the third potential application that still I'm excited about all 3, even though I prioritize them, is really in the emergency room, where patients come in short of breath, and it's not always clear as to what makes the patient short of breath. Is it heart failure with buildup of fluid? Or is it one of the other many causes that can make people short of breath? Could this be a pulmonary embolus, a clot in the lung? Could this be an infection? Could this be that the patient aspirated some food? I mean, there are many things that can make people short of breath. So the SeeMedX, or the bioimpedance principle, would be useful in kind of diagnosing whether this breathlessness is due to too much fluid or potentially due to some other cause. So yeah, so many potential exciting applications to the SeeMedX technology. So I am delighted to be a member of the SeeMedX advisory board. I am really excited about the potential difference this could make to management of patients with heart failure, whether it's in preventing hospitalizations or in simply making the diagnosis of heart failure.